Starting in a few seconds. Good evening, everyone. Welcome to Medical Mondays with Dr. O. To another exciting evening where we share correct, congent medical information. I am Dr. Toyin Okwesomi, a physician in Maryland. I'm a family practitioner, HIV specialist, and I treat addictions. Tonight, we have the privilege of having again one of our very own, Dr. Ojimba, who is a board-certified psychiatrist in adults or general adult and addiction psychiatry. He comes with a wealth of knowledge. He received his general adult psych residency and addiction psychiatry fellowship training at the Interfaith Medical Center in New York and Montefiore Albert Einstein College of Medicine University Hospital, also in New York. He attended University of Wolverhampton in the United Kingdom, where he earned his master's in public health and also worked several years in the UK, in the United Kingdom, as attendants before coming to the US. He has experience in emergency medicine, as well as in other areas of medicine, like internal medicine, and as well as psychiatry. So you know that he comes to us tonight with a wealth of knowledge. So bombard him, please, with questions from any area because he can handle it. But he is in private practice now, established a psychiatry and addictions practice in Columbia, Maryland. And so because mental health is so important, and because our community especially needs to learn a lot more about mental health, I asked that he will come tonight to bless us. And it's a blessing, really, to have him come to impart into us. So without much ado, I'll let him complete, his introduction, if I missed anything, and I will yield the floor to him. So, Dr. Ojimba, the floor is yours, and welcome to Medical Mondays with Dr. O.
Oh, thank you so much, Dr. O, for amazing and excellent work you're doing in our community, in sensitizing us in various different areas of medicine, health, our well-being. It's really well appreciated by a lot. I probably know that there's so many people that may not be able to tell you this, but I know that a lot of people are benefiting. Personally, since I got to know about this, I've been a constant participant, and I do enjoy all the different topics. Some of them I do not even know, and I'm learning, So thank you so much for that work. And good evening, everyone, wherever you may be. I know it's evening. I know there are a lot of people from outside the United States who are part of us. So welcome to Medical Mondays. And today we'll be discussing mental health. Mental health is actually one of those areas of health that most times we don't talk so much about it, but it's actually the engine of our health. I will get to that point. So today we'll be discussing about the prevalences, the causes, treatments, barriers to treatments, and prevention of mental health. By way of introduction, mental health disorders are very common, not just only in the United States, but globally. It is actually estimated that 1 in 5 people in the United States live with mental illness. This was a statistics as of 2017. The most recent one is actually higher than this. 46.6 million people in the United States as of 2017 living with mental health. Of course, after the COVID pandemic, the number skyrocketed, and it's been more than that. Mental health disorders range from common disorders such as anxiety, which actually is the commonest of all mental disorders that we have globally and as well as here in the United States, followed by depression to more rarer disorders such as schizophrenia, bipolar. We may have heard all this, or we may have seen people who are living with some of these mental health conditions. So understanding the prevalence, the causes, treatments, barriers, and prevention can actually help us to improve our mental health care and reduce the impact of mental health disorders on individual and the society at large. There are some facts, and these are facts, that there's no health without mental health. This is a fact, and I'm going to explain why. Because it's not the saying when it's only the living that thinks about other things in life, right? It's only when you are alive that you think about other things. And that is how it is with mental health. If you're not mentally healthy, every other areas of your life will suffer. And that is true. So mental health is an integral aspect of our overall well-being and quality of life. Just like as physical health is crucial, mental health plays a pivotal role in our ability to function, cope with stress, engage in meaningful relationships. The World Health Organization defines mental health as a state of well-being in which an individual realizes their potential, can cope with the normal stress of life, can work productively, and contribute to their community. So as we can see, this actually tells us what mental health is all about. If we're not mentally okay, we can function in any relationship, family, work, just name it. We're not going to be able to function. We're not going to be able to produce in whatever capacity, even as leaders, as parents, in whatever form, we're not going to be able to do anything. And that is why overall mental health is so important. The significance of mental health, this is just some of the things I've just talked about. Our mental health influences our emotion, thoughts, behavior, and overall outlook on life. Our good mental health contributes to better decision-making, effective problem-solving, and enhanced resilience in the face of challenges. Poor mental health can lead to a range of issues, including reduced productivity, impaired relationships, and even physical health. It's just like that, this interwoven connection between mental health and our physical health. And oftentimes, mental health can lead to physical health, all sorts of physical health conditions, and vice versa. Sometimes the physical health can lead to mental health. So the impact of mental health on society. Societal productivity is linked to the mental health, to the mental well-being of its members. And this is true. When people are mentally healthy, they are more likely to contribute positively to their communities. Conversely, untreated mental health issues can have economic implications due to decreased productivity, increased healthcare costs, and absenteeism. Serious mental illness cost America $193.2 billion in lost earnings per year. So you can imagine that that's a lot to lose just because of mental health. So we're now talking about the prevalence of mental health disorders. According to the World Health Organization, mental health disorders are prevalent globally, affecting more than 1 in 4 at some point in their lives. And this is on the global scale. For that of the United States, it's 1 in 5. And the global burden of disease studies report that mental health and substance use disorders are the leading cause of disability globally. So we can imagine how mental health can actually not just affect the global, it's a global body, yeah, not just one society or one continent or one country. Anxiety disorders are among the most prevalent mental health conditions, impacting approximately 1 in 14 people worldwide. Like I said before, anxiety is the #1 common mental illness globally and also here in the United States. Depression is the second widespread disorder affecting more than 264 million people of all ages. So we see depression in young people, in children, in teenagers, young adults, and the elderly. Approximately, like I said, approximately 1 in 5 adults in the US. That accounts to 43.8 million, or about 18.5% experiences mental illness in a given year. So think about it. What is the population of the United States? About 300 million plus. And out of that, 18.5%, experiences mental health in a year, every single year. It might be more than that now. Mental health disorders affect individuals from all races, ethnic backgrounds, but prevalence rate can vary. And this actually where we're going to touch how mental health affects our own population, people of color, particularly the Black communities. Prevalence rate vary across regions due to cultural, socio-economic, and environmental factors. So, for instance, the prevalence of certain disorders may be higher in low-income communities due to increased stressors and limited access to resources. Among African Americans, the prevalence of specific mental health conditions may be influenced by factors such as the cultural beliefs, the socio-economic status, and access to care. And this is actually, this is very important because when we talk about the African Americans, we can actually link that to all of us, people of colors, the minorities. So the prevalence, there's so many factors, culture, and that is why these days in psychiatry, there's aspect of psychiatry called cultural psychiatry, because there are a lot of things that are in some certain cultures, it might be seen as normal, while in other culture, it may be seen as something else. So understanding the culture of a particular race or ethnicity is very important in making actual any diagnosis of mental health, and in also being able to support them in their needs for the mental health care that they deserve. So factors contributing to racial disparity in prevalence. So, like we talked about before, there are certain conditions such as depression, anxiety, post-traumatic stress disorders may be more common among African American communities due to their unique stressors and experiences. And this is true. Say for example, let's use one of the most populous countries in Africa, Nigeria, right now. When you see the level of hardship, the level of suffering that people go through, and not being able to meet the basic necessities of life, that alone, unemployment, financial burden on each household, that alone can cause a lot of anxiety, that alone can cause a lot of depression. And considering things that people have gone through, like here, both in other parts of the African continent and here in America, the African American community, due to their journey through slavery and what they have encountered and how that has affected generations upon generations. And it becomes kind of a vicious cycle. that alone is causing a lot of traumatic event. And that's what happened. Like when we see our people of color or even of other race, you want to look at their experience, especially their childhood experiences. What is their journey in life? That tells you a lot. And you can trace back what is happening in adulthood, even when they were young, that everything started when they were young because of the certain experiences that they encountered in one time or the majority of their life. The socioeconomic factors, discrimination, historical trauma, access to culturally competent care can impact mental health outcomes. Take, for example, in our own belief, religion plays a significant role. Religious leaders can be part of the mental health professionals. They help. There are some people that, even though they are not well-trained counselors, but they serve that purpose, in some certain ways to kind of counsel and help, be a source of support to most of the people going through mental issues. And the stigma surrounding mental health in African American communities may contribute to disparities in seeking and receiving treatment. And this is where it's affecting us most. Because of stigma, most people do not want to seek help when the help is needed. This is the same with not just only mental health, this is the same with addiction, what we call the substance use disorders. Because of the cultural connotation, people don't feel like there's no need, or maybe if they go and seek for help, they'll be looked at people that don't have faith, or people that, they're not nobody in the society. So you can see, and this is something I see a lot, most times, most of the lost follow-ups I've had in the course of my trainings are people. You will see them and they will come, and most times some of them won't follow because sometimes you are not able to tell. It might just be discouragement from other members of the community, or maybe because of the way they feel. So all of us have a significant role to play in encouraging our people to be able to seek for help when it is needed. So we're talking about the factors contributing to mental health disorders. Mental health disorders are complex conditions that arise from a combination of factors. It's not just one. It is multifactorial. So there are a lot of factors. Sometimes it could just be one. Sometimes it can be more than one. These factors interact and contribute to the development of various mental health issues. So we look at the biological factors. The biological factors talk about genetics. Genetic predisposition plays a role in the susceptibility of mental health disorders. And this is true. Studies have shown over and over. Things like depression, anxiety, bipolar, schizophrenia. These are genetically inherited, and they can be transferred from one parent to the other. And when you see someone with depression, most times ask, is there anybody in your family? When I mean family, I mean first degree, second degree. Parents who have the similar symptoms. And I can tell you 85% of the time, the answer is yes. And most times it comes from the mother. It might be the mom who has some of this. Sometimes it can be the dad. Majority of the time, they are from the maternal lineage.
Ewo.
So imbalances in brain chemistry, neurotransmitters, neural circuit can contribute. So there are a lot of neurotransmitters in the brain that when some of them are like either low or high, that can contribute um, to certain mental health problems. Things like dopamine. We may have heard about the dopamine, we may have heard about the serotonin, GABA. These are all neurotransmitters in the brain that if it falls short or be higher than what it should, there's no balance between all these neurotransmitters that can actually lead to um, um, mental illness. Ironically, they all serve different purposes. Like dopamine is the neurotransmitter that dictates or that helps us to enjoy everything that is pleasurable in life. The same dopamine can lead to things like psychosis if it is short. Right. So there are a lot of factors. There are all these neurotransmitters. There are so many of them, but these are the common ones. Norepinephrine. These are things that can actually, norepinephrine can, excessive norepinephrine in the body can lead to anxiety and other things. Serotonin can also contribute to that. So all these neurotransmitters in the body can actually lead to mental illness, either higher or lower dose. Epigenetic factors, and these are like more of gene expression, the way they are expressed, the way they can be affected by the environmental factors that can actually cause mental health problems. Environmental factors, like we talked about before, traumatic experiences such as abuse, neglect, violence, all these can actually lead to mental health disorders. We talk about the domestic violence. It can be any form, physical, psychological, sexual, all kinds of traumatic experiences. Chronic stressors, such as things like financial difficulties, unemployment, all these things can contribute to anxiety and depression. And childhood experiences and early life adversity can shape our individual mental health through lifespan. And this is actually where we have to kind of learn more. And it's actually something that intrigued me when I see a lot of some teenagers or maybe even adults, and you ask them questions. Some of the events that happened when they were young, as teenagers, or when they were young as children, are the things that keeps affecting them. So it's actually imperative that we pay attention to our younger ones, the kids, the teenagers, just to help them, because most of the things that happen to them may be the cause of the lifetime mental illness. So it's better we help them to avoid some of those stressors or exposures that could lead to mental health. Then we come to psychological factors. Personality traits and coping styles can influence how individuals respond to stressors. And for example, two people can fail examination. One person can look at it and say, well, that's not the end of the life. Look at what happened, learn from it, and move on. The other person might just like, this is the end of my life. And that becomes the cycle, and people, the individual can now go in the states of depressed mood, and sometimes that could lead to suicide, where people have taken their life. So, and some of these things sometimes depend on personalities, the kind of personality traits that might be inherited or that might have been learned from people before. And negative thought patterns and cognitive distortions are associated with conditions like anxiety and depression. And this is why one of the commonest and the formation of all therapies in psychiatry is CBT, cognitive behavioral therapy. We have CBT for anxiety, CBT for depression, CBT for psychosis, trauma-focused CBT, because most of the things that happen is all about distortions in our thoughts towards events that happen in our lives. I just gave an example of how an event might happen, and the distortion in our thoughts and the way we take it, not giving it a rational thought to make a well-informed decision, can either create or worsen an existing anxiety or depression. Low self-esteem and poor self-efficacy can impact mental well-being. So that's, like I said before, mental health can be caused by a single factor, or it can be multifactorial. So there's sometimes you have a combination and interaction between all these factors, the biological, the environmental, the psychological. They can interact with each other, and you have multiple of them playing out in just one individual. So we'll talk about the common mental health disorders, talk about the anxiety disorders, still the common mental health illness in the United States, as well as in the world, affecting about 40 million, about 18.1 of population of every year. So that's a lot. They affect about 284 million people globally. So anxiety disorder, excessive worry, fears, uneasy that can interfere with daily functioning. You know, it's normal for people to worry about things. That's okay. That's normal. I mean, sometimes you could think about things, but that's okay. But by the time it begins to affect your daily functioning, that you're not able to perform to your optimal, you're not able to care for the people around you or do things that you're supposed to do, then that's the time you actually need to start seeking for help. And different types of anxiety disorders, things like generalized anxiety disorder, panic disorder, social anxiety or social phobia, and specific phobias, specific of so many things. And this where things like agoraphobia comes in, fear of height, fears of different things. And symptoms may include from restlessness, difficulty concentrating, physical manifestation like heart palpitation. People have been to emergency rooms so many times thinking that they have, especially among young people or even elderly people, think they have a heart attack, but because it's just a panic attack coming from anxiety. And mood disorders. So mood disorders affect individuals' emotional states, include conditions like depression and bipolar. So that's when we talk about mood disorder, we can group it into two, either bipolar or depression. And major depressive disorder is characterized by persistent feelings of sadness, hopelessness, loss of interest or pleasure, what we call anhedonia, in what people originally enjoy doing. It affects more than 264 million people worldwide. So this is the second most common mental illness in the United States and globally after anxiety disorders. Then bipolar disorder involves cycles of depression and mania with episodes of heightened energy and mood. So when we talk about bipolar basically is it could be just mania, or it could just be a combination of mania and depression. So we think about things like PTSD and OCD, post-traumatic stress disorder, and obsessive compulsive disorder. PTSD can occur after a person has experienced a traumatic event, and sometimes it's not just experiencing it. For the fact that people were told of what happened, for the fact that people witnessed what happened, like a lot of people after 9/11, they were not part of it, but for the fact that they heard it or they even saw it on television, how the whole scenario, how everything played out, they developed PTSD. So PTSD sometimes doesn't occur in individuals just because they experience it themselves. Either they witness it, or they heard, or it happened to someone they know, or they heard about it. like most times, all our first responders, some of them have PTSD just because they are first liners to help people who are experiencing some of these traumatic events. Obsessive compulsive disorders, characterized by unreasonable thoughts and fears, obsession, and because the obsession about something causes so much fear that fear will now compel them, what we call a compulsion, to want to do that thing that they are obsessed about. So sometimes when people keep, it could come in form of ego dystonic thoughts, where people keep thinking about a particular thing, and if they don't do that, they feel like they're going to die until they do it. And that is how we can define or talk about obsessive compulsive disorder. And it affects about 2 to 3% of the population. And that's still significant. And psychotic disorders such as schizophrenia, which that is the commonest one and everybody knows, but even mania can cause some psychosis. But in psychotic disorder, the most important thing that people are out of touch with the reality in terms of the way they think. There's a thought, we call it thought disorders. That's the old name. Thought disorders, distortion in their thinking, their perception, and reality. So they're out of touch with reality. They tell you things exist that don't exist. They tell you they hear things that is not actually in existence. So this is how we look at it. But there's so much more to psychotic disorders. And schizophrenia, which is actually a severe mental health illness, is a disorder characterized by distortion in thinking, perception, emotion, language, sense of self, and behavior. And it affects about 20 million people globally. So you could see things like hallucination. That is, hallucination could be in so many forms. It could be auditory hallucinations, hearing things that are not there, visual hallucinations, tactile hallucination, but the one that affects when we talk about schizophrenia is more of auditory hallucinations. Delusions, sometimes we use that phrase. I mean, the word a lot, like someone is deluded, but in psychiatry, that's a way we can define delusion, of course. And disorganized thinking and social withdrawal is the hallmark. So most times for caregivers, parents, whenever you see a young person who all of a sudden begin to isolate, withdraw from what they used to be and who they used to be, a lot of things should be coming to your mind. Of course, there are so many things like depression, substance use, psychotic, it could be so many things. So don't just think that it's normal. Find out why that child is actually all of a sudden having such an isolated attitude. And we have things like eating disorders, which can include the anorexia nervosa, bulimia nervosa, binge eating. And with this involves extreme emotions, attitude, and behaviors surrounding weight gains and food. So some people sometimes don't want to eat because they feel they're so big and fat. Meanwhile, they're underweight. Some people overeat and then devise self-induced vomiting just to kind of reduce what they have eaten, not to gain weight. Some people eat in secrecy so much in a little amount of time, and that's what we call binge eating. So these are the things that can happen. We have substance use disorders, which can actually cause mental illness. All kinds of substances. We have the ones called the downers, the stimulants. So stimulants can cause things like psychotic symptoms. Downers can cause things like depression. And sometimes when you are withdrawing from them, the opposite happens. Even cannabis these days, cannabis can cause a lot of psychotic symptoms. It can worsen existing anxiety. So substances can cause a lot of mental illness or worsen an existing mental illness. In fact, as a matter of fact, I've had kids in their teenagers in their 14 to 16 and the young adults who have been using cannabis, and most of them developed psychotic symptoms. Evidence-based treatments. So in treating people with mental illness, there's no one should have fixed all. A lot of things can be involved. Psychotherapy is one of those core treatment modalities that we use. Sometimes people call it talk therapy, but talk therapy is not, that is a layman's term to describe it. But most, like I said before, you have different types of therapies in psychiatry. Things like CBT, we use in virtually most of the mental illnesses. We use things like dialectical behavioral therapy for those that have borderline personality disorders, things like mentalization therapy. There are common things now like mindfulness therapy. These are all that you can use to help people to be in the moment, to help them to alleviate the anxiety, or help them in their depressive mood. But the core therapies that are used, like CBT, DBT, ACT, these are kind of therapies that are being used. So, and it can be done on individual basis. It can be done as a group. It can be done as a family. So we have like things like family therapy, couples therapy. So these are kind of therapies that are being used to be able to help individuals who are struggling with mental illness. We have medications. So medications for all kinds of disorders. We have antidepressant, anti-anxiety, antipsychotics. These are kind of medications. So proper medication management involves regular checking with healthcare providers to monitor effectiveness and side effects. And we have a combination therapy. Actually, we preached, not just because the studies have shown that people who use a combination of medication and psychotherapy, the outcome is a lot better compared to people who are doing one of those. So when I know sometimes there are barriers to having these two together for so many reasons, which we're going to talk about. Then there are things like holistic approaches, things like yoga, meditation, art therapy, all these things promote well-being. And we can talk about maintaining a healthy diet, physical activity, because when we engage in physical activity, it helps to release the endorphins, which is good for the body, and getting adequate sleep. And this is what I tell all the patients. You cannot joke with night sleep. Night sleep, don't ever joke with it. Night sleep is not the same thing as daytime sleep. They're not the same. If you sleep 8 hours at night and sleep 8 hours during the day, they're not the same. Why? Because for some reason, the nature designed night sleep that a lot of things happen during the sleep. A lot of hormones are secreted. A lot of healings are done. Cells are rebuilt. And that is actually when we call the memory potentiation happens. That is why people who are studying, it's advisable that when you study, have a good night's sleep so that whatever you study, your brain can potentiate and make that into stick. So cognitive issues. Good sleep helps with cognition. So don't joke with night sleep. If you're not sleeping okay, you need to see your doctor. You need to see anybody who is well skilled to be able to treat and help you with your sleep. So, we have mental health professionals, we have psychiatrists, have the advanced psychiatric nurse practitioners, have the psychologists, we have the therapists, we have the counselors. They're all there, but of course, everybody have their own area of expertise on what they are, what they should be doing. So come to barrier to mental health treatments, and these are the areas we're going to look at how it affects our community and how it affects even people globally. Stigma and cultural beliefs, and this all of us can actually this resonates a lot with most of us, because stigma surrounding mental health illness can lead to fear, shame, and reluctance to seek for help. And this is exactly what we talked about before. Cultural belief and misconception about mental health may discourage individuals from seeking treatment. And that is true. Again, we come to lack of awareness and education. All of us here tonight, let's please go and be a conveyor of this message. Let's help people, because a lot of people, maybe they don't understand mental health issues can hinder how it can hinder their function and their potentials in life. So limited understanding of mental health issues can hinder individuals from recognizing their symptoms and seeking for help. So sometimes things might happen and we can look at it like, oh, that's normal, that's cultural, but it may not be. Take for example, I know things like the example I'm going to use here is like things like ADHD, attention deficit hyperactivity disorder. It's actually it's a diagnosis that is there. Of course, we know that kids can be playful. We know that things can do a lot of things, but sometimes when it becomes too much and we see that it's affecting that child in their education, in whatever they are doing, and the teachers are complaining and talking about it, that is the time for us to do something. Don't say, oh, I mean, that's just a child being a child. Yeah, because what happens is this. If a child has ADHD that is not treated, it can affect that child's educational performance. And if it continues, this because of impulsivity that goes with ADHD, and again, as teenagers, as they are growing, their frontal cortex, which is responsible for the executive function in decision making, is not fully developed until the age of 24. That is why young people make a lot of impulsive decisions and mistakes. These are the things that can, most times, these kids are prone to being involved with the criminal justice because of impulsivity, in addition to the impulsive nature of the ADHD. So you see how that can kind of affect the child and may end up causing more harm if it is not taken care of on time. Because sometimes some parents are very conservative. Oh, I don't want to start a child on medication. But the thing is this, the advantage of starting that child on medication far way outweighs the advantage of, or disadvantage of not starting the child on that medication. So let's watch out and be careful and help to advocate for parents, young parents, and our own people, our community. Raising awareness through education campaign can help break down these barriers. And that's what we talked about. Financial limitations. The cost of mental health care, of course, including therapy and medication, can be a significant barrier. Lack of insurance coverage or high out-of-pocket expenses may prevent individuals from seeking treatment. This is true because these days, most of our therapists do not want to accept insurances. A lot of people want therapy, they need it, they want it, they have insurance, but because some of it, I would probably say maybe 70% of therapists out there do not want to accept insurance because of problem of dealing with insurances. So, and most people don't have that money to be able to pay on a weekly basis for as long as they need to do that. So these are some of the limitations. Sometimes the out-of-pocket cost of insurance can also be are huge and a big hindrance. Limited access to services. Many communities, especially in rural areas, lack sufficient mental health resources and professionals. Well, and this is true, at least thankfully for the advent of telehealth that happened during the COVID, at least those in the rural areas now can still be able to have access to providers. Limited access can also lead to long wait times or even prevent individuals from receiving care altogether, and that is true. So in some places, there's a long wait. And this is not just only mental health, but in other specialties. People are looking to have their first intake, and they're telling them that's the next available appointment is in 3 months, 6 months time. Meanwhile, the person needs it now. So, breaking down obstacles from improved access to care. So, recognizing and addressing barriers to mental health treatment is crucial for promoting equitable access to care. Efforts to reduce these barriers can lead to a better mental health outcomes for individuals and communities. And this is actually where we have to get involved in policy making, get involved in our communities, get involved in county politics, be able to talk to our representatives, and be able to meet them and tell them what our communities are lacking and missing and how we can help our communities. Raising awareness and reducing stigma. Public education campaign can challenge misconception and reduce stigma around mental health. And here, I think a lot of people can be involved, religious bodies, the churches, wherever in town meetings, anywhere there's a kind of a gathering or a community meeting, this would be an opportunity to kind of maybe once in a while to talk to people about the importance of making sure that they are having access to mental health. And if they don't know where to go, they can always ask questions, and there are people there who are there to help. So we're talking about the cultural competent care. Mental health professionals should be trained to provide cultural sensitive care. And this is actually now, it's actually become one of the requirements in most of the even licensed renewals. They are making physicians, to become culturally competent. So that they call it implicit bias training, and cultural sensitive training. In most of the state right now, if you want to renew your state license or this, they will ask you this question because it's very, very important. If you don't know people's story, if you don't understand their culture, you can misdiagnose and misinterpret their culture as a disease condition, and you may not be able to help. Take for example, back home in Nigeria, people can walk barefooted, right? And people will see that as, okay, it's normal. Most kids walk barefooted back home. If you walk barefooted here, the next minute you are seeing yourself in the emergency room. And before you know it, you are being given an injection because they think someone who comes here newly without knowing that, and nobody happened to teach them and tell them that you cannot walk barefooted here, if not. But again, these are some of the things. So I use as an example, but again, being able to understand some culture, or for example, speaking in tongues that is so common back home. That's the way you do it here. You'll be seen as someone who is having auditory hallucination, being internally preoccupied. So these are so many cultural issues that we have to be able to understand individuals. And like Hispanic population have some of the cultural things that's peculiar to them. The African American have some cultural things that are peculiar to them. So like when someone dies, we cry so loud. That's a way of grieving, right? If you hear in the white population, they don't cry, that much. So if they don't understand our culture and they see somebody crying because someone died, then they will look at it like, oh, this person is actually insane. But that is someone expressing their own grief in their own cultural way. Affordable and accessible services. Policies that improve insurance coverage for mental health services can make treatment more affordable. Increasing funding for mental health programs can enhance access to care in underserved areas. And these are policy issues that we have to get involved to discuss with our representative or get involved by ourselves or push people who we know that can actually advocate for all this for our people. So integration of mental health care in primary care, this is actually what this is happening. It's been existing now for a few years, collaborative care models where the primary care physicians work with behavioral health team as well as the psychiatrists so that a patient can be cared and still remain under the care of the primary care physician. So we talk about preventing mental health care. Of course, things that are preventable can be prevented, but if the things that are genetic, sometimes it might be difficult, but you can reduce the harm. But the ones we can prevent, those ones we can do that by doing regular exercise, a balanced diet, sufficient sleep, contribute to overall mental well-being, engaging in physical activities, also release endorphin, threat management, learning effective stress management techniques such as mindfulness, relaxation exercise, those are very important. And also that helps also to reduce the anxiety and mood symptoms. Social connectivity, social connection, this aspect, I think this cannot be wanted in most of the African population because we belong to so many social and community meetings. That this study that have been a decade-long study for ages, and that study has been done over and over, and it has shown that the single most important factor in longevity is social connectedness. Not even healthy eating or physical activity, or it's just social connectedness. So building social connectivity is very important. It increases longevity. It helps us to be able to share our own ideas, interact with other people's, and also share our concerns and worries with others. You just don't ever underestimate what you have when you have good people around you. A good family support, a good social network support. Those are vital and those are very important. Recognizing early signs of distress and seeking help promptly can prevent the escalation of mental health issues. Seeking support from friends, family, professionals can also provide valuable experience. So, promoting mental health awareness, we talked about it. Educational outreach. So in any setting that you find yourself, please do that. Schools, workplace, community meetings, community organizations, in workshops, in churches, just do it. Supporting mental health organizations is another way. You can volunteer, you can donate, you can advocate for mental health organizations. Those can contribute to this effort to promote mental health awareness. Using media and social media campaigns these days, the era of social media, whichever one you belong to, Facebook, Instagram, anyone, Snapchat, use those opportunities to promote mental health and all the barriers to that. Storytelling and personal experiences. These can help. People can use their own story, their own personal experiences about how they have recovered or how they have dealt with their own mental health experiences. And that can be, a source of strength and support and encouragement, and maybe make people who haven't actually thought or who have been so scared to look for help to finally come out and seek for the help that they truly deserve. So building resilience for mental health wellness, developing coping skills, cultivating social support, fostering a growth mindset, and practicing self-care. These 4 elements very, very important to building resilience for mental wellness. Self-love. I always say this to my patients. You gotta love yourself first before loving any other person. Because loving yourself means giving yourself all the best love. In terms of your mental health, your physical health, before you can care for other people that you love in your life. So if you don't care for yourself, how can you care for others that you love? So self-love and self-care, very important. And this comes to the end of my presentation. This is just a snapshot of what I have for you tonight, and I hope I've been able to pass at least a little bit. I didn't want to go into detail because each of these discussion or what I've just mentioned today, we can expand on it endlessly. And I want to say thank you for listening.
Wow. Wow. Thank you so much. Look, I've put you out there on the AMPA forum. This is an amazing psychiatrist. Thank you. When you pick that topic, mental health, I'm like, oh my gosh, how are you going to touch all of those? You did. And geez, I have so many questions, but I'm not going to be selfish. I'm going to start, and I'm going to start from behind, while I'm giving others opportunity to ask. Somebody asked question though on the forum, but I wanted to bring up a point and ask you this. In our community, our Black community, you said, when you were talking about the number one type of mental health issue that is out there is anxiety and affects 84 million, something like that, followed by depression that is 248 million, something like that again. And it affects mainly our people. Isn't that incredible? Everything we've talked about, anything that comes up in medicine, it ends up being the disease of Black people. And thank God, that's why we have this forum. The problem, and the problem though, is that mental health is something that our people don't want to touch. It's taboo. Nobody talks about it. You talked towards the end about sharing personal stories. This is taboo. Our people don't talk about it. How can we break the stigma of mental health and have our people embrace the fact that this thing can happen? And you've talked about different ways that people can end up having various aspects of mental problems. How can we break the barrier? How can we break this stigma?
Yeah, thank you so much, Dr. I think, it's actually...
Yes, 1 minute. Can you put down the slides so that it would help me, so
okay.
that raise their hands and all, I will know. Thank you.
Awesome.
Sorry to interrupt.
No, it's okay.
I didn't realize that I didn't have my camera on even. Sorry.
It's okay. So
can you pull it down, the slides?
Okay, just a minute.
Thank you. Dr. Ephraim.
Let me stop sharing.
Got it. Thank you. You're good.
Yeah.
Good. Yes. Thank you.
So yeah, thanks for that. Thanks for that question. So It's actually a tough one, very because of the culture connotation that goes with mental health in our society and in our community. But I think people are people are coming out to be able to discuss mental health. And I think for us now who are knowledgeable about it, we have to be the advocate. We really have to educate people who probably are in the position of being able to have a large audience. And when I say that, take for example, when I was talking, I talked about our religious leaders, because these are places that our people go to, and these are places that our people, the people that our people will listen to when they speak. Again, we can use such avenues to be able to kind of advocate for mental health. Because at the end of the day, by the time we can list the benefits of having a healthy mental health, just like I said, there is no health without mental health. There is no health without mental health, and that is true. And that's something that we really have to focus on and say over and over for people to be able to kind of understand. Look at how easy it is for other communities, like white communities, to be able to talk about mental health on the national television. Look at Michael Phelps, who is one of the world renowned swimmers, and look at what's her name, the Olympian, and all of them. So they can talk about the mental health freely, and it kind of promotes, and they are becoming champions. So we can start and use the same, and our celebrities, those we have within our communities, those that we know that people can listen to, be able to use them as those advocates that can talk to people and let them know. And if there are people who have had experiences about mental health and how they have been helped, those are opportunities for them to be able to also use their whatever platform that they have to be able to talk to other people about mental health. But it's something that we just have to continue to do, something we have to continue to push. We just have to push until something happens. You know that word push. You push until something happens. We just cannot stop pushing. So we just keep advocating. We just cannot afford to relent and say, okay, I've said it, but nobody's listening. Whatever opportunity that we have, anywhere we see ourselves, in a small clinic, in a big venue, anywhere, let's use that opportunity to be able to talk to advocate for mental health and tell people the importance of actually having an overall mental health well-being.
Thank you. Thank you so much. I have a couple of people who have their hands raised, and then I have some questions in the chat box, but I'm going to call on. Okay, there's somebody here that says iPhone. We are begging that if you please put your name, even if it's initials.
Could that be me? Could that be me?
I think that's you.
Oh, I'm sorry.
Oh, Auntie Lara, you at.
I was driving. I was driving.
That's okay, ma. Go ahead. Ask your question. We know who you are. I know you, so I can identify when I call. There you go.
Absolutely.
First Lady Lara. Yes. So.
Yeah, I think, Dr. O, you asked a very important question, which is how to get our people to talk about it. But it's in mental health, and I think that everybody have an element of mental health at this point, because everybody gets in a toxic situation, but it's been demonized, which makes it difficult for some people to actually step up and say, I need help. We have to start reframing what it is, total wellness or whatever, like the speaker said. If you lose your mind, you don't have everything. If you don't have sanity, you don't have anything else. So I think if there's a way to start reframing what it is, because here, when the many people know that if a kid has autism, it means that that kid is super intelligent in another spectrum. People are actually happy to say, oh, my kid has autism. They're proud to say that, just because they know that means it's another level of, what do you call it, intelligence. But this mental health issue, we would have to figure out a way to reframe it in our community so that people can understand the essence of it about getting help. That's my 2 cents.
Wow. Ma'am, your 2 cents is deep, but I'm not surprised because you are in this space also. And that was why I asked the question. So, Doc, what do you say?
Yes, I think our First Lady is absolutely right. Reframing some of its terminologies is actually can help depending who you're speaking to. Like, for example, in the addiction world, because of the same stigma that goes with mental health goes with addiction, in the past, things like substance abuse, we don't use the word like substance abuse, we use things like use disorders. We don't use the word like addicts, we use the word like people are using. We don't use the word like things like urine is dirty, or that we use the word that urine is positive or negative for this and that. So kind of reframing the terminologies can also help. But again, unfortunately, in mental health, there hasn't been much of any reframing. Depression has been depression for ages. Anxiety is anxiety. The only thing I think we just have to do, especially, of course, we can find a way within our community to make it, because to let them know that this is not a death sentence, rather is something, the way I explain it to my patients, and that is the way we should be explaining to everybody, is mental health is like any other condition. It's just like somebody having diabetes. You can imagine, you can imagine when you tell someone, oh, it seems like you have high blood pressure, the next thing is that, God forbid, that's just high blood pressure, right? Okay.
No, it will not be my lot in Jesus' name.
So, right. So when you have those kind of answers, so it's just the same thing, but you explaining to them like, okay, mental health doesn't mean like it's a death sentence. It's just a way of like, and everybody mustn't be on medication. Sometimes you just have to do some therapy work. Sometimes you might take medication. It depends. And if you have to take medication to be able to function effectively and be there for your family, which one is better? So we just have to look at the advantages and kind of equate mental health like any other physical health. Like the way people have diabetes.
I'm sorry, doctor. The thing is with Nigerians or Africans, even those who are comedians, they can't tell their parents, I'm a comedian. What do you mean you're a comedian? You went to college to be a jester? It's a mindset with our community. So,
and yeah, that is true. That is true. And that actually part of those things, developing our mindset, the way we think, that is the whole thing. Letting people know that, sometimes the way we perceive things is not actually the way it is. So there's a lot of education that has to go. And maybe if we succeed, if all of us can take a challenge to succeed in developing, kind of educating and convincing one person, which that one person can go in turn and convince another person, and it goes on and on and on. But I don't expect it to be something that will be happen overnight or in the next. It's going to be a gradual process, and thankfully, the newer generations are kind of getting it. The newer generations are getting it. They are more open to accepting mental health. because I've seen people, young people, and they will tell me that when I was young, my parents didn't want me. Like literally, I had a patient who, was expelled from their master program because of ADHD. And then the patients came back and told the mom, and the mom was like, I'm sorry this happened. I knew you were having problem with focusing when you were young, but I didn't know that it's gonna be this bad. I apologize, but I think it's time for you to look for help. So, and that these are the things that happen. Sometimes some of our parents will be the one that may not want the child when they were young and when they were suffering or having some issues to be able to seek for help or to get counseling, get therapy, things that will help them to be able to build self-confidence, to be able to overcome anxiety, to be able to overcome depression or whatever that might be causing it. So these are some of the stories that we can be using to be able to tell when we tell some of our people the advantage of seeking help versus not seeking help. Maybe so of course I'm not saying all of them will understand, but some will understand at some point. And maybe let's target the younger generation, but maybe the people that we also have to focus more are the ones who are having younger kids, mothers and fathers of younger kids, because the kids is not going to be independent until they are 18. So they're under their care until they are 18. So most of the decision makings will be done by the parents at that point. And if nothing is done earlier, by the time they are 18, things could have gone so bad. So it's tough. I must admit it's tough in our community. Well, the only thing we owe to our community is just to continue to educate, continue to advocate in whatever form, in whatever shape, anywhere that we feel it, in churches, in community meetings, in family gatherings, anywhere. And you notice something in a child or in a parent or in any individual, and you think you have a knowledge of what is going on, you can talk to them that I think you need to see someone.
Thank you so much. Appreciate that. So, Auntie Tawa, you have your hand raised, ma. Thanks for your patience.
Good evening, everyone.
Welcome.
Dr. Ojimba, did I get that right?
Yes, you did.
Yeah. It looks as if they are so fast in labeling kids here with ADHD something. Most of the things the kids do here, if you go to Nigeria and do that, they will use cane to get it out of your head. Honestly. But here they start doing, oh yeah, is this, is that. Do you believe everything is really psych? Or because some of the kids, they take advantage, they learn and they know that if I do this, yeah, I'll get away with this.
So that's I think thank you for asking that question, Ms. Dorje. So I can say that of course we have kids who have ADHD for ADHD, and we have kids who might be in between, but again, that is why in the diagnostic criteria of the of ADHD, it's not done at some certain age. At least it is left until between 5 and 7 years, when you can say that that this child is actually old enough to be able to do some certain things. And most times these diagnoses in kids, because in kids it's much easier to make, is observed. The same thing is observed in different settings and being reported by different people. So the parents will fill it a form, the school teacher will fill their own form. And if there is if these two individuals who are caring for this case at different times is able to say the same thing, sometimes, and the only thing is that when you treat those kids, you can see the difference, and parents will also notice the difference between when the child was not being treated and when the child was being treated. And by treatment, I mean maybe giving them medication that they can use to help them. And why this is actually why this is important is this, because untreated ADHD, it definitely, especially if it's severe one, can make a child to drop out of school, can cause so many harms down the line for severe form of ADHD. Mild ADHD, kids can get away with it, especially, in a structured setting when they're in elementary school, middle school, where the task is not that much. But as they begin to get to high school or college, when they become so independent and the assignment is piling and they have to meet deadlines, that's when you begin to see the manifestation, So yeah, some kids can actually navigate those earlier in a more structured setting like elementary, middle school, maybe high school, for milder form of ADHD. But the severe ones, those ones they can't even pass or go beyond elementary school, because they can't focus for possibly more than 20 minutes. 20 minutes probably is even max, and they're very hyperactive. They're very impulsive. So those are the things that they look at before making the diagnosis. But of course, again, it varies from physician to physician. Some psychiatrists or maybe any pediatrician who can make the diagnosis, some people might be quick to make the diagnosis. Some people might be very conservative in making the diagnosis. So it depends on who is actually dealing with that child at that particular point in time.
Yeah.
Thank you. My other question is, do you agree using native medication, like Papa Dr. Oye said, in conjunction with the Western medicine?
Well, okay, so I'm not sure. The only medication that I would concur to use are things that can get into the child's body that at least we know what it is. Things like I mean, like if there are things that's like medication, I mean, like creams that you can put on the child's body, or things like essential brand, things that we know that can help. Let's say a child is having cold and you want to use things like essential balm to massage the back of the child, or all those things. Those ones we know that can work. But if they're like herbs or concussion that I don't know the components or the mix-up, I wouldn't advocate for that to use in combination with any other pharmaceutical medication that is, at least that is well refined and we know what it contains. So yeah, I'm going to be hesitant to advocate for use of what I don't know the ingredient. If you tell me maybe avocado, that this is made with avocado right now, maybe I'll say fine. But if I don't know what it is, I'm not sure I will advocate for any parent or anybody to use any concussion that they are not sure of what is inside it. And together with, because again, some of these things can interact, right? It might be something, the same thing, and then because you don't know what you're getting and you're adding into this, they interact to each other. Either this one makes the metabolism of the other one slower, and then you have a toxic level in the body. So one has to be careful.
Thank you. Thank you. With ADHD, Auntie Tawa, there are criteria we use to diagnose, and Dr. Ojimba is right on the money. When you have a child that really has ADHD, in my experience, even when it's mild, I worry because even in elementary school, because they can't focus, then they don't have a good solid foundation to build on. You want to catch them early, you want to help them. They don't have to be on the drug 7 days a week. We actually advocate drug holidays, like take off like a couple of days, especially on the weekends when they are not studying. But it's not good to allow a child, have anything and not treat it, because we want to give them a good foundation. But I see your point, because sometimes it is lack of discipline that children have that, that made them not to listen. One has to be careful in, deciphering. So I agree, but that's a very important subject. As Dr. Ojimba said, each one of these things can be a topic in themselves that we will thrash. So I have a question in the chat box before. Sister Rosemary, get ready, because I saw your hand raised before. This question says, you should please allude to chemical dependence and legitimization of marijuana. The same person asked another question before, that you should include the influence of social media addiction on mental health. So social media addiction on mental health, that's huge these days, especially in children, even adults. Because I've seen, I have to say this, in the past, you go to the restaurant and you see a family eating and they're enjoying themselves. But now in restaurants, you see everybody on their cell phones. Nobody's talking to anybody. Even when the food is there, they're still navigating the phone. And, I just wonder. So influence of social media addiction on mental health, as well as the, chemical dependence and legitimization of marijuana. Thank you.
Yeah, thank you very much for the question. So of course, when you talk about chemical dependency, I guess that we're talking about substance use disorders here, and that's an entirely huge topic on its own. So with cannabis, I think I talked about it a little bit, how cannabis, I've seen, for like literally today, had a patient who came in and was diagnosed with bipolar, but again, when I kind of, because that's what I call timeline, when I kind of go timeline and down the lane, like, let's say a very young guy, of course, I mean, the child has been using cannabis since the age 12. And this is something that we have to look out in our younger ones, because these days, even though the medical marijuana that's been talked about, cannabis has two components, the CBD and the THC. The THC is actually the one that causes the problem, the psychotic components, and the CBD is more the calming one. That is the anxiolytic. That's when people use, they say, oh, it calms me down. That's actually the CBD component of that. But the truth of the matter is this: even with the medical marijuana, there's no 100% CBD. In fact, if you ever get 40% CBD, that is high, and this is very expensive. So, and there's always a CBD THC ratio, even in the medical marijuana that was sold. And when people use that in people who are predisposed to anxiety, it can worsen the anxiety. THC component can worsen the anxiety. And when you are not using, and maybe you use and you're stopping, you are withdrawing, it also worsens the anxiety more. So that is actually, in terms of legitimization, of course, it's not something I want to go there. From the our academy, the Academy of American Addiction Psychiatrists, and as well as the American Society of Medical Addiction. So they haven't actually they haven't an APA as well, American Psychiatric Association. They haven't endorsed officially, because there's no evidence-based study out there in terms of the use of cannabis for any psychiatric symptoms. So that is why if any patient comes to me, I'm like, oh, doc, I'm using it for sleep. I'm like, well, I'm not going to recommend it. It's not something I know so much about. And of course, I've had some patients tell me that, oh, it worsens my anxiety, so I stopped using it. So I'm like, okay. Or maybe it's not even helping my sleep. Some patients might just have a temporary relief over like few weeks, and then the reverse becomes the case. So it's a tough balance. I would say it's more political than any other thing, because there's no so much stuff. A lot of studies have gone in, but if it's been positive, I know FDA would have approved. That's only one indication that it's FDA approved for medical CBD, which is that seizure, reconstruction seizure. But other than that, every other thing are like more of a case studies, at this point. So we don't know. So on the part of legitimization, from the addiction part of things, we are, of course, I think the lobbyists were more powerful than the academy. So it's not something the addiction world has actually endorsed from legalizing it. But in terms of criminalization, that's a different ballgame. So, of course, people shouldn't be criminalized for using cannabis, but they need to be treated if they are using it. So that's a different ballgame. But kind of legalizing it for recreational use is a different ballgame. So on the issue of social media and the internet addiction and how it affects mental health, that's a known fact, because like I said before, the brain, what makes us to make decisions, what we call the executive function, make an informed decision about our lives, about the future, about whatever we're doing, is actually our prefrontal cortex, which is actually our prefrontal cortex on this part of the brain. It's not fully developed until the age of 24. And that is why you see teenagers making impulsive decisions and all these things, because, and again, watching or being on social media or constantly stimulating that part of the brain can kind of, that's a way we term it, like when as you're growing, your brain is being coded. It's just coding, programming it to be able to function. And anything, it could be substance, because when we say substance, we mean drugs or illicit substances, and then can decode it and make things go wrong. And that's what happened. That's what, when people get so addicted to use of, or maybe using internet or social media more than expected. And again, of course, not just because of using it, but what they see and other things that are not real kind of affects their emotion. The way they perceive things immediately distort their thoughts, and creates a lot of anxiety, a lot of depression, sadness, and other things that go with it. So that's a whole lot of things, a lot of factors playing up at the same time, worsening and predisposing and precipitating mental health in young people and teenagers who frequently use social media more than they should. I don't know if I'm able to answer that question. Yeah.
Thank you so much. I think that was Dr. Ajagbe. So give thumbs up if your question is answered. But we're going to have a session on marijuana, medical marijuana. We will in the near future. I don't know when. Dr. Ojimba, I'm going to bring you back by the grace of God. At that time, we can have a panel and discuss it. I think it's a big one and we need to talk about it. There's another question he has, that how has the recent pandemic affected mental health in the general population?
So that's a known fact that the recent pandemic actually affected mental health globally, in so many ways. Actually, for me, like I had two publications during COVID that, like, people, young young kids who probably haven't even had any mental health issues ever in their life, but in their teens committed suicide. I mean, and thankfully, of course, it was unsuccessful, but and when you ask, it was as a result of the COVID. People, these are people that normally go out every single day and go to Manhattan. This was when I was in New York. But because of pandemic, they were constantly staying in the same house. You know, house is actually a big issue in New York. And it kind of it get to the point that they just, and the teenager, they don't know how to handle it. They feel like the best thing is to kill themselves. So and a lot of patients, a lot of kids, come to the hospital, come to the clinic, and you ask them questions. All of them is just because of COVID, a loneliness, doing the same thing over and over. And we talked about social connectedness, right? How I said that increase. So you see, like when people who probably go out on a day-to-day basis, do other things, and all of a sudden you find yourself in a very secluded place, how that can actually affect your mental state and your mental well-being. And if you haven't built enough coping skills, and that is why, like I said, teenagers, because sometimes their decision-making can be very impulsive because of the part of the brain that is not yet fully developed. You can take some irrational decisions at that point. And that is actually why is as part of the mental well-being, to be able to build enough coping skills and resilience to be able to help us in difficult time, because there will always be difficult moments in our lives. That then is those skills that will be able to help us navigate. But yes, actually, global mental health globally. COVID affected mental health globally. There was an uptake, a huge uptake in mental health. In fact, just recently, there was a paper that came out like about 4 days ago, about the US suicide rate hitting the highest ever. So that is and these are the effects, still the effects of the COVID and the pandemic, and we're still dealing with it. People have not fully recovered. People are still going through tough times. So yeah, the COVID pandemic affected increased uptake in mental health illnesses, and predisposed those that maybe their mental illness would have come out in 10 years' time, came out just in 1 year because of COVID. And it's still happening, even though at least things are a lot better now.
Thank you.
Mm-hmm.
Thank you. Dr. Dwayne thanks you and says autism is a phenomenon that the young generation struggle with. Please address the spectrums and how caregivers could effectively manage the daily behavioral struggles, both at home and school. Okay, we can't. That's a whole topic. So we're going to be here for the next hour just on that. So Dr. Dwayne, I promise you, we will address that sometime. Just even talking about the spectrums is wide. Am I right, Dr. Ojimba?
Absolutely. I mean, the only thing I can say, of course,
thank you.
Autism is a huge topic. It's a spectrum that goes from mild to moderate to severe. And at this point in time, there is no treatment, FDA-approved treatment for autism, except for behavioral component, which is like the aggression that comes with it. The only two FDA-approved medications are aripiprazole, which is Abilify, and risperidone, even though sometimes it's not effective. And you see people like today, I saw a show who is like a bunch of medications and all atypical antipsychotics just to be able to manage the aggression of the autism. And so it becomes a thing of like what helps. So depending until you find the balance. It's actually huge huge burden on the family to deal with. And there are so many ways. I mean, there's so many things involved, and those are not the things that, of course, we can talk about today. But the care for patients, especially patients who have a severe on the severe spectrum of the autism, it's really a big one. You know, caring for such child, and when we see parents who have kids with severe autism, we should actually applaud them for the work that they do, because it's not easy. I can say. But yes, Doctor, unfortunately, we're not going to be able to explore all those today. But yeah.
Especially when the kids are growing older and be big and oh gosh. Anyways, so I have a question here from Rafiu in Nigeria. It's still up. It says, what happens if the medications are discontinued abruptly in mental health treatment? What improvements can be expected and when? He asked two questions.
Yeah, so Rafi, thanks for joining. I know it's late and you are awake. Again, just like in any other medical profession, we don't advise patients to discontinue any medication abruptly without consulting their medical provider, because some medications have what we call the withdrawal symptoms and can be very fatal and severe. Take, for example, sometimes we use things like benzodiazepines to treat patients for some certain anxiety disorder or other things. If you ever take that medication, if the patient has been on it for a long time and you withdraw that patient without separating it off over an extended period of time, that patient can go into a severe seizure and they can die from that. And the same thing with other medications like antidepressants. Medications, they need to be slowly tapered off. If you withdraw them abruptly, they can have withdrawal symptoms that will mimic a very severe anxiety, and that's going to be very uncomfortable for the patients. So some of the medications have the withdrawal symptoms and should be slowly tapered off. So if you have people who are on medication, just advise them not to. If they ever wish to stop their medication, they should discuss with their doctor before that happens. I don't know if what you're asking is, should people be on medication for life? And if somebody stop medication, how well will they do without the medication? There are two ways. Patients who needs to be on medication should be on medication. But for people who probably have first episode of depression and anxiety, and you treat them and they get well, they've learned all the coping skills to deal with their anxiety and depression, they can be slowly tapered off and see how they cope without medication. If they relapse without medication, even after having all the coping skills, then probably that might be an indication for that person to remain on medication for at least the most of their life. It might just be on a maintenance dose. It may not just be on the same dose, but because if you take a patient off medication and they relapse, what that tells you that this patient needs to be on that medication. And you don't stop those medications at least until after 12 months of stabilizing the patient on that medication first. And then you could slowly taper and see how they feel. But these are for patients this is like first episode in their life, they are having such presentation. I don't know if I'm able to answer your question.
I think you did. Mental health, antidepressants, anti-anxiety medications usually don't kick in like you're treating pain. We encourage that you continue to take it, because for depression, it takes maybe around 6 weeks before you get the full effect of it. So you really shouldn't be stopping the medication. That's my take, Dr. Ojimba. From the primary care perspective, that's the way we back you guys up, that please don't stop your medication, because it takes time to even get good into your system. And then when you stop taking it, people still feel good for a while because it doesn't wash off right away. But then when it washes off, then they're back to square one and worse. So I agree with you. Our admonition is don't stop your medication. Let the doctor and you decide and taper off if need be. So there is a question here. Are there tips for parents to help on adult child getting through mental health issues that gets to the suicide level beside going to the hospital and praying? Thanks for an informative and timely session. That is Dr. Fawale from New Jersey. Hi, Doc.
Right. All right, Dr. Farley, thanks for that question. Suicide is something that we don't joke with, and that's what we always tell everybody is so important to us, to the United States, to the world. We don't want anybody to die. But of course, we do our best to do what we call suicide risk assessments in patients. So, that's always prior suicide attempt is one of the most important risk factors to future suicide attempts. So if an adult is having a suicide ideation, that's what we call the ideation is different from an attempt, intent, or attempt. So if somebody is having thoughts that they're going to do something, so the question is, do you have anything in mind, or is there something that you plan to do? So if have they done anything like that in the past? If they have ever done anything like that in the past, that is actually the most important thing that you need to know. If they haven't done anything in the past, you want to know if they have any plans, do they have any intent to do anything? You know, if they are guys, you want to know if they have guns in the home or other things. But if you don't have the skill to do all this, the most important thing is if the person doesn't have a primary psychiatrist to talk to at that point to do an assessment, the best thing is to call 911, please. Prayer is not, you can pray for these patients while they're in the hospital, but don't keep them at home while you're praying. Because the thing is this, even we as professionals, no matter how careful we are to treat patients or to do all the analysis, people who are determined to kill themselves will kill themselves. That is true. That is true. Because the thing is that unless you're going to be with that person 24 hours, and that is why once they go to the hospital, if you're not sure what they're going to do, you keep them on one-to-one where somebody is monitor them 24 hours and observe, and every harmful thing that they're going to use to commit any acts of suicide will be taken away from them. So if you're keeping somebody at home and you're not going to be there to watch that person and know what you're supposed to do, don't take that chance. Please call 911 and take the person to the nearest emergency room for safety. Safety is a priority at all points.
Wow. Thank you.
You're welcome.
Go ahead, us. It is it's a new case, and it's really an attempt. He made an attempt, and I was just wondering if there's anything parents can do to help. Now, the parents actually have a child in the home now, trying to help him out. I'm just wondering if there's any tips that we can give to this parent to help their child now that they already saw an attempt for suicide.
Oh, okay.
Yes.
That kind of makes sense. So if the child had an attempt, had been to the hospital, was taken care of course, the most important thing now is to find out what happened. Of course, what was the reason why the attempt happened in the first place? If it is something that can be avoided, the parents should do everything to avoid it. Like maybe if it is, because sometimes like family dynamics could be a trigger, other things could be a trigger, and And then, of course, the patient has to follow up with a regular checkup with psychiatrist or any mental health provider that's been attacked. And there has to be, at this point, the patient has to be initially probably like 2 weekly therapy sections. And maybe after that, after like maybe 3 months, because it could be like a weekly therapy section with a therapist where the therapy has to be checking in, they have to be checking on each other, and just looking at why the parents will also be doing their own. So it's going to be a multidisciplinary approach in terms of doing their own work at home, while the mental health professionals doing their own bits with the patients. And all of them will be working together to make sure the patient is safe. And if there are other things that the patient, if they know what the patient used before, and if they see that anything is changing in the patient's mood or stuff like that, they just have to act proactively and just make sure that nothing happens again.
Can I please
Thank you.
add one more thing to that?
Okay.
It can make such a person get a pet,
Yes, please.
whether
Go
a dog or cat, you know, because a lot of times it starts with a self-esteem issue or feeling unloved. It's not anybody can do, but if they can pour their own love out to something, some object, some animal, sometimes it does help in addition to the medication. It doesn't negate the medication, but getting a pet for that person that he or she can nurture is going to be a good.
Can I say something, please?
Go ahead.
Thank you.
You know, Sister Rose, we have people. I told you, our first lady is in this space, taking care of various patients like this. And Sister Rosemary is a counselor. Go ahead.
Yeah. So in that situation, I would advise the parents of that individual to avail themselves for counseling, because you have to understand the root cause. If they know the root cause, they'll be able to go around it. And the parents, you know, I would say something first of all, you know, mental illness is you know, the brain is an organ. It gets sick just like every organs in the body. So there's no big deal about, you know, the stigma. So I want everybody to know that. And as we take care of our physical well-being, we have to take care of our own mental well-being also. Very, very important. People don't take time for themselves. It is not good. So let us make it a point of duty to take time for ourselves also. And secondly, when you have your kids living with you at home, and they lock themselves in the house, they isolate themselves all the time. Please, they are not just quiet. Question it. Try to find out what is going on. You know, get them into therapy on time before it is too late. And if they refuse to avail themselves, because I have a client right now, you know, the couple, they told me that the kids will not avail themselves for counseling. They know that something is wrong, because I told them that, look, if they locate themselves in the house, in the room, something is definitely wrong. They said the children will not avail themselves for counseling. I said, okay, let me work with you guys. And then when I started working with the two of them, I found out a whole lot of things, and they changed the way they approached the children. They went home, they apologized, they called a meeting, apologized to the children. Guess what? The kids are speaking to them today at home while they are going through their own counseling. Let's go back again. I will suggest to everyone here that before your children, because we all have kids that are marriageable age, before your children get married, please tell them to go for counseling, because there are some things that we did not do right as parents, because there is no blueprint to parenting. So let the children go through counseling or go try to find out who they are, because identity crisis is the biggest problem in the world today. People not knowing who they are. Just like the president said right now, low self-esteem. What is self-esteem? Self-esteem is your self-image based on system of values, memories, and feelings that you have put together about yourself. The Bible says, as a man thinketh, so is he. You will be and become the way you think, feel, and believe about yourself. So whatever that you're thinking about all the time is what you're going to be bringing into your own experience. So if you don't watch your thoughts, those things are going to start manifesting in one's life. So it is so important for us to really, 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 really think about this. And Dr. Ojimba, thank you very much for your presentation. You spoke about love. If we do not love ourselves, there is no way we can be able to love somebody else. Lovelessness is the biggest problem. If you look at sorry guys, I'm a Christian, I'm going to be referring back to Bible because but a lot of people are Christians and they can be able to identify with that. If you look at 1 Corinthians 13, it says love is patient and is kind. Love doesn't judge. It believes all things, it hopes all things. Can we be patient with ourselves? Can we go through long suffering without lashing out? So all these things, can you continue believing in yourself even when you know that things are not going on right? So we really have to bring people and really try to make and mold them. The only way we can influence our children is if we ourselves know who we are. If we become strong, if we have that knowledge, we'll be able to pass it on to our children. So before your kids will get married, please let them go for counseling, take care of their own mess, their own issue, so that they can be able to choose the right spouse. Because we are spiritual beings. We are made up of spirit, soul, and body. And the soul consists of your mind, will, and emotion. Okay? When people die, they will say, may the soul rest in peace. But what about when they were alive? The soul was all over the place. Try to be everything. Come on, we cannot be everything. Thank you very much. Sorry, that's all I have right now. Thank you.
Wow. Thank you.
Thank you for all the suggestions.
Thank you.
Very emotional.
That was kind of, thank you.
Yes, we appreciate you. Thank you. And I was just told by our doc here, Dr. Ajay, the 988 Lifeline provides 24/7 confidential support to people in suicidal crisis or mental health related distress. By calling or texting 988, you'll connect to mental health professionals with the Lifeline network. Please snapshot that. Remember 988 and get connected. Somebody said in the forum, I think, I'm going to read it later because it wasn't a question, so I didn't read it yet. But I have to mention it now that everybody has some touch of mental health. We have been posting Dr. Ojimba's info, his office, his website. If you need to contact him and that survey to copy that, please do it. We have a gem, a tool in our hands, and it does telemedicine. You can be in California, in Texas, anywhere, and it can see you. In New York, it can see you. It will let you know if somebody it can see and telemed with you. So you don't even have to come into the office. Now, counseling, psychiatric care, a lot of it is done by telemedicine. It's become virtual. So that is amazing. It's important. It's because the need is seen that, especially after the pandemic, we need that. My sister Abby in London posted that in the UK, you can call the Samaritans 24/7 if you feel low or suicidal. She's in the UK, and hello, Londoners who are on the forum. Let me greet you. Dr. Ojimba.
Yes, ma'am.
There's a question here that says, how late can a person be diagnosed with ADHD?
Okay, how late? So most of the ADHD actually starts from childhood. Of course, we now have a lot of adult ADHD, and adult ADHD doesn't mean that it just started. It's like most likely what happens is that this person probably had ADHD but was never diagnosed. Probably they have a minor form of ADHD, and maybe, like I said before, they managed to scale through, but as they are beginning to get involved in much bigger commitment task in life, they begin to notice, and sometimes they may not be the one, it might also be other people in their lives kind of noticing that they're having a lot of symptoms that might be similar to ADHD symptoms, carelessness, forgetfulness, easily distractibility, unable to focus, multitask, and all whatnot, so there is a screening. There are other tests that can be likely kind of give an objective finding whether someone truly has an ADHD. And of course, most of the psychiatric diagnosis sometimes is based on history taking. We don't have to do any particular kind of test to make those diagnoses. So yeah, people can be diagnosed in their adulthood, but most likely they had it in their childhood without being diagnosed. That's not ADHD that started in adulthood. That is evidence-based. That's not ADHD that started in adulthood. Yeah, it just most likely started in childhood, but was never diagnosed.
Thank you.
Yeah.
Dr. Jagbe asks, please address the effects of mental illness on sleep. That's another huge one. I know.
Yeah.
That's another topic.
Well, I mean, the truth of the matter is that most of the mental health do affect sleep pattern. But the only one that could probably give you maybe excessive sleep is atypical depression, where you have hypersomnia as opposed to insomnia, where you see in melancholic depression. But most of the virtually all, say like 95% of all psychiatric illness probably will cause a sleep distortions, unable to sleep, either difficulty in sleeping or waking up multiple times at night, not being able to sleep. Some people probably may not even sleep at all, like people like that have a manic episode and symptoms. So yeah, and that is why sometimes all the time it's always good to look at people's sleep and like, are you sleeping okay? If they're not sleeping, then you have to help them to be able to find find out the reason why they're not sleeping. Some people would do like things like sleep hygiene, and these are the things. I'll probably say it here right now that, your bed should not be, people, it's like a status symbol to have a big screen television in your room, right? That bedroom should be meant for sleep and sex alone. That is it. Not
There's
more.
one more thing, prayer.
Well,
3 things.
prayer, and maybe prayer can be done another place, but yeah, that's a prayer there. But our bedroom
Prayer,
should not
sex, sleep. 3.
Yeah, it should not be where people should be doing their business meetings or watching television. You want to kind of program your mind that whenever you get into your room, to that bed, that is just to sleep. Once you program your mind like that, it will help in a way and make it as comfortable as it can be for sleep, right? And then if that doesn't, of course, take away any caffeinated stuff, any caffeinated drinks in the evening, this thing are like sodas. Soda contain a lot of caffeines, and that is why we don't advocate to give sodas to kids, because somebody say, oh, this kid, they take soda, they're hyperactive, they jump all over the place, but it's just the caffeine in the soda. Avoid late night exercises, late evening exercise. Do much of your exercise in the evening. You don't want to stimulate your body in the evening. You want to put your body in a relaxed mode during the night. So these are what we call like sleep hygiene, we'll call it CBT for sleep, all the things that you have to do without medication to be able to help your body to be in that mood of sleep. If all these fail, then medication becomes the next thing. Right.
Thank you. Thank you so much. Auntie Tower, you have your hand raised, man.
Dr. Ojimba.
Yes, ma'am.
For some people that have mental problem, they do know they do, and you try to help them, but they don't want to be helped. What can you do?
It becomes a very difficult one because the adults, like, it depends on the severity and the kind of mental illness, right?
Mhm.
If it becomes on the severity, like if the adult and they don't want to be helped, but they're able to function, you can't do much. If you call mobile crisis or anything, they will come, they tell you, oh, patient is functioning, they won't do much, right? But if the patient's life is in danger, if patient becomes a danger to self and to others, it becomes a public a public importance. At that point, if you call 911, they will come and take that person, take the person to the hospital. The only fortunate thing is that in our East Coast, I mean in DMV area, I think the voluntary and the involuntary admission that is so little compared to, I'm coming from New York. You know, if patient is seriously ill and they need help, by the New York mental health law, we can keep them in the hospital up to 60 days. At least, yeah, they can be in the hospital up to 60 days. But here, this is even worse. You know, the public defenders in this year, they're advocating for the patients is good, but at the same time, if the patient needs help, you have to advocate for the patients to get the help. You know, so that's where we have the conflicting issues. But that's the only thing you can do. I mean, at that point, if they're able to function, all you have to do is to continue to persuade them to see if they can seek for help. But if they get to the point that they are a danger to themselves and to others, then you have to call 911 or mobile crisis team to help.
Thank you. And also, forgetfulness and senior moment. Has it anything, has it got anything to do with a psych?
Forgetfulness and senior moments. Well, it's a combination, but that's what we, you know, that's what they call senile dementia, right? Or senile, it depends, but we don't want to call any we don't want to take things for granted. So that can be done, but I mean, a psych person can do that and probably at least do cognitive assessment, like what we call the mini mental status examination, or do MOCA test to be able to assess cognitive deficits. If it is so severe, depending, he could liaise with a neurologist and they could find out, do some other, probably that needs to be things like CT, MRI, and other blood work just to be able to see what is going on. So it depends on the age. You know, there's some things that can be considered as a normal aging process, but there's something that could be seen as more than what it should be seen in that individual for their age. Yeah.
Thank you.
That's a good one. That person needs to be evaluated, right, Dr. Ojimba? Because it could be depression. You know, depression is a constellation of symptoms, and one of the symptoms is forgetfulness.
Absolutely.
And lack of concentration. And people can decide, they can then say, oh, it's senior moment. Is it really senior moment? They need to be evaluated. So we have to treat individually. Look, Dr. Ojimba talked about hypersomnia, somebody sleeping too much. That could be part of depression. Whereas the same depression in another person could be them not being able to sleep. They have insomnia. So people have to be evaluated to know exactly what the issue may be. So, Dr. Ojimba, you talked about social connectedness, and I just praise God that we have that in our community. Isn't that incredibly amazing? We do. There's a lot of things that we say we need to change. We need to change. I don't want anyone to feel like we always talking about negatives. We're not. We're talking about things that we can prevent, that we can cause not to happen. But we have a lot of strengths in our communities. One of them is that social connectedness. We are very good at coming together and supporting each other. I just lost my uncle in Chicago, and the outpour of love is just amazing. And I'm going to share this quickly because we had a friend who came and wanted them to drive everybody away so that my aunt, who just lost her husband, can be alone. And I'm like, heck no. First of all, it's not cultural. That's not our culture. Secondly, mentally, it's better for her to have people around her at this time, because the time is going to come after funeral and all, people will not be coming like that anymore. She would have time to reflect. Right now, I don't want her to even think. I want her to just, I want her to enjoy everyone around, and that helps the mental health. You also mentioned, in connection with that we should get involved in policy making and politics. I was like, wow, in mental health? Yes, I get it. I never connected it until you said it tonight. We need to get involved. If we don't get our voices heard, then we need to be quiet when things are going the way we don't want them to go. And that is why I encourage everyone on this platform to join NAPAC, Nigerian American Public Affairs Committee, because it's a forum where you can, and you will, not even can, get involved politically and put people in place that can effect and affect policy. We are doing that already. You continue to hear more about it, and our convention is coming up in November 2nd to 5th. Remember, Medical Mondays family, you all invited so that we can meet face to face and, join the NEPA crew and learn more on how we can get involved. That alone.
MVDP. That's a good
The MVPD. It's Virginia, DC, Maryland, Delaware, and Pennsylvania that we're together here. And when you want to talk about region, it expands to North Carolina. So Dr. Ojimba, please talk briefly about that, how getting involved in policy making and politics actually impacts us mentally.
Yeah, so policy making is actually what affects. As a clinician, I can affect just a few individuals. Maybe in my lifetime, you could count the number of patients I probably may have seen, right? But with just enacting one policy can affect millions of people, just millions of people. So, that is actually the way I looked at it. We can actually get involved in so many ways, depending where we find ourselves. It can be at the county levels, it could be at the district levels, it could be at the state levels. So what I would say is this, like, because when we
Dr. Ojimba, just come be my guest at the MVDP event. Bring your spouse, sit at my table, then you know to talk more about NAPAC, okay?
You know what she's saying? She's paying for your seats.
Okay, thanks.
She just gave you a couple of $100. I'm going to put that down in my notes.
Thank you. But yeah, so basically, it's something I've actually been thinking that we should be doing within the counties where we find ourselves, getting involved, find out where the political meetings are happening, find out when the decisions are being made, find out who is going to be our representatives. And at some points, we just have to push our own people who we dare to speak for our community. So, and even if at all our own community member is not part of that, then whoever that we're going to support, we have to get them involved, get them committed to be able to do things that will favor our community, that will actually work and help our community in so many areas. And now we're talking about mental health, but it may not be limited to mental health alone. be limited in other areas that we think that our communities are suffering and they need help to be able to. So that is how we can get involved. And again, sometimes it may not just be there is a power in number. So when you have a group of people coming together and pushing an idea, and they look at the number of people that are involved in this, they will think twice. They will know that these people mean business, right? Just take for example, the way AMPA, which is a body for the Association of Nigerian Physicians in America. AMPA is so powerful these days that the mayor of New York had to work with AMPA, to be elected, So we have to begin to make ourselves available. The current governor, being a Black person, these are opportunities that we can use to tap into, what can help our people to, so we just can't sit and think that things will happen for us. We have to begin to act. We have to begin to make some moves and begin to get involved. That is the way I look at it, and I believe that we should be working towards that.
Wow. Thank you so much. Talking of New York, NAPAC was very instrumental also in that election. So you see how we all tangle and work together. And I'm part of both organizations, by the way. No wonder my mental health is so solid. You need to follow suit. So, thank you so much. And Dr. Veronica just posted in the chat box, how you can actually join NAPAC. It's very easy. It's a couple of steps to do that, to click on the website. So Dr. Ajagbe did come back, brought us back also now to, his line of work. He's talked to us a lot about obstructive sleep apnea and said that it has been directly correlated with ADHD in the pediatric population. 9.6% of pediatric population has sleep disordered breathing with obstructive sleep apnea. And he said treating obstructive sleep apnea has successfully improved the ADHD to the point of weaning them off medication. Thank you for that information, because we know that, right? Dr. Zip, I'm throwing it back to you for comment, if you have any on that one. Obstructive sleep apnea and ADHD in children.
So it's not something I've actually looked more into, so I may not have much to say with obstructive sleep apnea in children. But of one thing I know about with ADHD, that's not something I've actually looked much into. But yeah, obstructive sleep apnea can actually affect kids in so many ways. But I guess with the ADHD component is something that I have to explore to understand more about. Right, thanks for bringing that up. Yeah.
Thank you. So there are a slew of thank yous on this platform. The people are thanking you, appreciating this presentation. Herman in London, in the middle of the night there, says, enjoying presentation today, big talking point in the UK at present also. He said, thank you for the presentation, that he enjoyed the self-love aspects and making the most of good support systems. Also fighting the stigma of not wanting the shame of our children getting support with medication. He liked those. Mama Alberta, thank you so much that the forum was very educative tonight. Abby in London said mental health awareness is of utmost importance because everyone has a level of mental health issues, though not necessarily outright ill. She says healing begins with talking and being aware of the different levels of spectrum of the mental health issue. She said some community, BAME community, I don't know what that is, communities are usually closed and do not want to talk about their issue because they do not want to be labeled as being mad. In the UK, she says mental health first aid classes are offered to make the topic more acceptable to people. So, Dr. Ojimba, that's something we need to look at here, because if you start that in your clinic, then we'll let people know and make it virtual so that, you know, we'll pay for it to come attend mental health first aid. You know, yeah, it's true. Anyway, we can, you know, bust this stigma and help our people understand more that mental health is something we need to pay attention to and take care of. Like you said, if your mental health is messed up, everything else will be messed up, period. Haman also said, important point about autism and how that is used with regard to its positive aspects, that many multinationals recruit individuals on the autism spectrum for significant career roles. Mental health has to find its own ground on a positive level. And Dr. Veronica from California expresses her gratitude for the education today. She says, thank you. Great comment, Madam CEO, First Lady. And Sister Clementina says, thank you for a good presentation on mental health and its challenges in our lives and communities. And said, thanks. And also thanks to Dr. Ojimba, Madam CEO, First Lady, for good presentation, and also myself. Dr. Ethel said, thank you so much for this important mental health presentation. And I think the thank yous are still going on. Powerful and amazing bullet points, Attorney Rosemary. Thank you, Rosemary. That's from Dr. and Dr. Ajay. And Abby in London gave us another number for the Samaritans, for people in London who may need assistance with mental health. It's 116123. And Omotara said, thank you, Dr. Ojimba and Dr. O, you know, for answering our question also. Okay, so this is from Nigeria. This is my Uncle Sonjo. Oh, wow. From Nigeria, he said, a big thank you to the hosts, Dr. O and Dr. Ojimba, for the beautiful presentation on mental health. Very interesting. God bless you all. Good night from Niger. It's 2:23 a.m. here. Good night, sir. And Dietrich Fortune said, thanks for a great session. Dr. Ojimba, thank you so very much. I wanted to read this out to let you know that our Medical Mondays family, which you are now part of, you've been part of, you know, really appreciate you. So if you give us your parting words, something we can take home, you know, to help us out, that would be fantastic. And again, everybody, I'm posting Dr. Ojimba's details. Again, please contact him. Let's utilize his services. There's no shame in mental health. It saves lives. Thank you. Dr. Ojimba, back to you.
Yeah, so thank you, Dr. O, for the opportunity to be able to educate and talk to our community, our people about mental health. And thank you, the audience, for listening, at least for those that are listening from other parts of the world, UK, Nigeria. I know it's so late, but you stayed. Mental health, like I said before, and that is the way I always put it, is there's no health without mental health. Mental health is like the engine of our health, and you know, just like the way the liver is like the engine of the body. If the liver is messed up, the entire body is messed up, because that is where everything is being metabolized. Without mental health, we're not going to be able to achieve anything and be able to optimize our potentials in life. So giving ourselves all the love and the self-care that we deserve, taking care of our mental health, our physical health is of utmost priority that we should do to ourselves, and that we should help anyone that we love to do, and that we should also advocate for in our communities. So please, as we live here today, as we have listened, and I know that for us to be here today, that we're so passionate about mental health. So let's just go out there and be precious of this word and be advocates to our people, to our community, about mental health awareness, about mental health, how it can really help us to be productive members of the society. And for those who are struggling, or for those who still need help, the help is actually there, and we can help people to come out of their cage and to be able to break the barriers, the yoke of the shame and the stigma and all the cultural norms that's holding them back. I say thank you and have a blessed evening. Thanks.
Thank you. Thank you so much. And thank you, family, for being here.